I was reading Weyward and came across a section that made me a little uncomfortable, something that men don't have to think about or consider. She asked for a female doctor, hadn't she? Yes, she's sure of it. The receptionist, likely the same woman staring at her now, had assured her that it'd be a female doctor. Dr. Collins is only available Tuesdays and Thursdays, she'd said on the phone, so you'll have to come in on one of those days if you want to see a woman. Otherwise, it's Dr. Radcliffe. Ah, sorry, she says as she rises from the seat, wincing at the feel of her thighs unsticking from the plastic. I think I was booked to see Dr. Collins. Couldn't make it in, says the male doctor, gesturing for her to follow him into the consulting room. Sick child, always the way with that one, I'm afraid. She hesitates. Part of her wants to leave, to ask for an appointment with the female doctor on another day, but she's here now and she's not sure if she trusts herself to come back. She follows the doctor into the consulting room. Just relax, he says. So what do you think? Is it normal to ask for a female doctor, be invalidated, and give a male gynecologist, and just be blown off like it doesn't matter? I was doing research on this. I came across a couple of things that were interesting. One is that some women state that they prefer male gynecologists because a handsome man between their legs relaxes them. And when men were asked why they became gynecologists, most of the answers were fine, but a couple stood out. One stated that they have a difficult time turning off that male part of their brain if the female is attractive. And another stated, I am granted access to her whole identity, and that is a great honor. What it boils down to is that just because you feel like it's clinical doesn't mean that they do. And that goes both ways. The patient can feel like it's clinical when the doctor doesn't. The doctor can feel like it's clinical when the patient doesn't. And what that means is that regardless of how low the predation level is, it isn't zero. That's not an indictment on male gynecologists. Most male gynecologists are fine. But it is an indictment on a medical system that dismisses and invalidates how a woman feels about her own medical treatment.